Imagine a world where a simple painkiller or a vitamin deficiency could be blamed for a complex condition like autism. Sounds far-fetched, right? But that's exactly what a forthcoming report from the Trump administration is reportedly suggesting. Linking acetaminophen, commonly known as Tylenol, used during pregnancy, and certain vitamin deficiencies to autism spectrum disorder, ASD. Here's the catch. There's little to no scientific evidence to back these claims. And this is the part most people miss. The report, spearheaded by Health and Human Services Secretary Robert F. Kennedy Jr., is just the latest in a series of controversial statements he's made about autism, often without solid research to support them. Kennedy has a history of making unsupported claims about autism, from linking it to vaccines to promising to uncover its root cause. This time, the focus is on acetaminophen and folate deficiencies. But here's where it gets controversial. The medical community, including the Society for Maternal Fetal Medicine, strongly disagrees. They emphasize that acetaminophen is not only safe, but recommended during pregnancy to manage fever and pain. Untreated fever, especially in the first trimester, could increase the risk of miscarriage, birth defects, and premature birth, while untreated pain can lead to maternal mental health issues and high blood pressure. Dr. Alicia Halliday, Chief Science Officer at the Autism Science Foundation, puts it bluntly. It's misleading to simplify autism's causes to one factor. Autism is a complex condition influenced by hundreds of genes and potentially other environmental factors. While a few small studies have hinted at a connection between acetaminophen exposure in utero and ASD or ADHD, the largest study to date, a collaboration between U.S. and Swedish scientists, found no such link. Even a U.S. district court ruled similarly in a product liability case before the study's publication. Now, let's talk about folate. Leucovorin, a form of vitamin B9, is sometimes used off-label to treat autism. Based on the idea that some individuals with autism may have a metabolic issue affecting folate absorption. But the evidence? Scant at best. While folate is crucial for brain development, which is why pregnant women are advised to take folic acid supplements, its direct link to autism remains unclear. The Autism Science Foundation notes that while 4 studies suggest low folate levels in pregnancy might increase autism risk, the research is still in its infancy. So why does this matter? Because spreading unverified claims can lead to unnecessary fear and potentially harmful decisions. Pregnant women might avoid acetaminophen for pain or fever, risking complications, or turn to unproven treatments like leucovorin. And this raises a bigger question. Should public health policies be influenced by controversial, unsupported claims? What do you think? Is this report a step toward understanding autism, or a dangerous oversimplification? Let's discuss in the comments. We want to hear your thoughts.